Great. Okay, and we're recording.
Mm-hmm.
Can you still see my screen? My computer just
Everything is fine. Yeah.
everything's good. Okay, great. Perfect. So, thank you so much for joining today. Today, we're going to talk about making a birth plan, as you know, or your birth wishes. And so, the reason we say birth wishes is because you can't really plan as much as we want to, as much as we try. It's very hard to plan for a birth. As you know, it kind of is unexpected. It happens when it happens, and it happens how it happens, not the way that you design it. However, it's really important to have these ideas and these wishes for your birth and the way that you would like it to happen. The more you know in advance, the
Mm-hmm.
better prepared you are for the birth. So that's kind of what we're going to focus on today. And since it's just you and me on the call, maybe we could take some time to get to know each other. Why don't you tell me about yourself and how you came to learn about Mama Doula Canada and everything?
Yeah. Um, so I'm expecting a baby now. I am in the 27th week and 2 days of pregnancy. This is my first pregnancy, and I am 38 years old. Like in terms of age, I feel a little bit like thinking that might not be like a normal pregnancy just by the age factor.
Okay.
But like by the doctors, as I am not having any trouble during the pregnancy and any other issues, I am quite not like in a risk group, like it's a normal pregnancy, but it's still lots of sore here and there now,
Hmm.
some difficult to sleep actually because of the sores. But other than that, I think like for the pregnancy itself is doing pretty well. But I hired Clay to be my doula.
Oh, great. Yeah, she's wonderful.
Yeah, I want to try to have the natural delivery. Um, but like I don't know, right? Like until the end of the pregnancy, still a little path to go before you mature enough for that one. But like I am planning to have the natural birth and overcome some fears and some doubts I have and questions I have as well, due to historic family issues that happened
Hmm.
with my mom, with my aunt, with my sister, and I had like one cousin that she actually passed away.
Oh, I'm so
Um,
sorry.
yeah, a few years ago, but she had a really bad experience doing these prenatal assessments with her doctor and was
Hmm.
OB by them. But she was okay one day. The next day, her blood pressure went like expressively high, and she had eclampsia, and so she passed away giving birth,
Oh,
basically.
I'm so sorry to hear that. And of course, it makes you feel a little bit scared because you've seen
It's
it
true.
happen. It happened to someone you know, and now you're in a similar situation that you think
Yeah,
it could happen to me. How do I make sure it doesn't happen? So I can understand the stress.
yeah, but like I now I'm a little better than I was before. But before I was thinking a little longer, like, oh, but if this happened to me, you know what I mean? Like, and I had some days that I start to swallow a lot, and I've been swallowing a lot,
Hmm.
regardless the amount of water I take per day or whatever diet I do, I'm swollen.
It happens.
And yeah, so and this is my moment now, with all this pregnancy pathy so far.
Well, thank you so much for sharing that, and you're in great hands with Clay. I know that she's going to help you through everything, and she's a wonderful doula. And I can see now that we have somebody else who joined the call. Hi, Anna. Anna, you're on mute. Can you hear us? Okay, maybe Anna is not coming off mute. But anyway, hello, Anna. We see you. Welcome to the call. We are recording the call, and I'll start off by saying a little bit about myself and who I am. So thank you, Anira, for sharing your story. My name is Kaitlyn. I'm a doula, and I've been a doula for about a year and a half. And I what else can I tell you about myself? I stay very busy. I'm a doula part time and I have another full time job. So my corporate life is Monday to Friday, 9 to 5, and then I'm a doula when I can be, because, like we said, birth is unpredictable and it happens. When it happens. You can't really plan it, so I have to be on call for my clients, and it's great. It's worked out very well so far with all my clients, and it's something I really enjoy. Something I love to do is being a doula. It really makes me happy. It's something I love. And before I became a doula, the reason I became a doula is because I've had such a passion for babies and for pregnancy and birth in general. I don't have any kids of my own, so I've never gone through it myself, but I have a lot of friends and cousins and family who, when they were pregnant, would reach out to me when they had questions. And this is before I became a doula. They would say, "Oh, hey, can I eat this? And is it safe for me to do that? And here's what I'm feeling. What do you think?" And I would always have some answers for them. And I thought to myself, why are you coming to me? Why are you asking me these questions? And my friends and my cousins and everybody would say, you just know this stuff. Like you just know it. So we trust you. We come to you because we know you're going to give us the right answers. And so I thought, well, that's very nice. Now let me make this make sense. Like I have to get something behind this so that I trust, everything. So that's when I decided to become a doula, and I did my training and have been supporting clients, excuse me, supporting clients for just over a year. And it's been really great, exciting work. It's very hard work, but I love it so much. And that's it about me. So I think I saw something come into the chat. Let me see here.
Yeah, Kaitlyn, this is a good story to introduce yourself as well. Thank you for sharing.
Absolutely. Thank you. I know I can't. Oh, here's the chat button. There we go. Anna says that she's listening because she can't talk. Okay, sorry about that, Anna. No problem. You're listening, and we're here to talk about making a birth plan. So what I started saying earlier is that birth just kind of happens when it happens, and the way that it happens, you can't always plan for it, but it's important to have your own wishes for what your birth will look like. And that's what we're here to talk about today. So going to our next slide here. Just as I've just mentioned, it's important to plan for things to not go as planned. But you are in charge of your birth, and so is your baby. So you and your baby are working together, working very closely. Even though it's not communication the same way that you're used to communicating with your friends and your family, but your body and your baby are communicating to get yourselves through it together. Even before labor begins, you're having a big conversation with your baby, and so it's very important to feel that connection and know that you and your baby together are in charge of the birth that you're going to have. But having said that, like you see in the big letters here, plan for things to not go as planned. So before I even get into talking about what are some of the things that we want to think about when you're putting together your birth wishes and putting together your birth plan, is knowing that sometimes you can have a perfect plan, but know that it might not always go that way. And so it's important to plan for your ideal birth and know what you want it to look like, but be flexible as well. So before we get into talking about the different stages of making a birth plan and what you should be planning for, I always like to tell my clients to use your brain when you're making decisions about labor and birth. And this is asking yourself these questions. The brain stands for benefits, risks, alternatives, intuition, and nothing or not yet. And those are questions that you can ask your care providers when you're presented with an option. So you may already have noticed during your pregnancy that you get many options and many opinions, not just like here are the options of things you can do and what how you can go about your pregnancy and what you can choose for yourself during birth, but you get opinions as well. You get people saying, "Oh, well, I did this when I was pregnant, and my cousin did that. You should try it." And so you get all these people telling you all their ideas, and it can feel really overwhelming. It can feel like a lot. So asking yourself these questions and asking your care provider these questions will help you to be educated and informed and then confident. So when you're making these decisions about what you want for your pregnancy and for your birth, it's important to make decisions that you feel good about, decisions that you feel are really going to give you the kind of birth that you're looking for, a positive one in the end. Essentially, everybody might have different things that they want to achieve and what different picture of what you want your birth to look like, but in the end of the day, everybody wants to have a positive experience. And the way that you're going to have a positive experience is by being educated and informed and knowing everything that there is to know about those decisions that you're trying to make. If you're trying to make a decision and you don't have all of the information, you might not feel like you're in the right position to make that decision. And so you rely on the people around you, your doula, your doctor, your midwife, maybe your family and friends. You ask questions, and that's a good thing. That's really what you want to do, is you want to be asking questions about things. And if you're on Instagram or you're on Google or something, and you read about delayed cord clamping, and you think, oh well, I keep hearing about this. I keep hearing delayed cord clamping, but really, well, what is it? And should I do it? And, you might feel kind of conflicted about whether or not that's right for you. The only way to know if it is right for you and for your baby is to ask questions and to become educated and informed. So asking the right questions will help you to feel more confident in making that decision. So these questions here, what are the benefits? That's going to help you to understand what what is a positive outcome that could come from whatever this decision is that you're trying to make. So let's use cord clamping as an example. Are you familiar with cord clamping? Have you heard of it? You know what that is?
I heard about it. I heard that sometimes it's good for you to hold a little bit longer than cutting right away for the benefit of the baby. But maybe a little bit more information would be great too.
Okay, good. No, thank you for answering. And you're right. And I think that's common. Like, I think most people, when they hear about delayed cord clamping, they've heard, something about it, but maybe they don't know everything about it. So we'll use that as an example here for these questions. So what are the benefits of cord clamping? So that's a question that you can ask your midwife or your doctor, or your doula. I know, Anira, you're working with Clay, but Anna, whoever you're working with, you can always talk to your doula in great detail about what are the benefits of cord clamping in this example, and then what are the risks. So what if I decide to delay cord clamping? What are the risks to me? What are the risks to my baby? These are the questions that we want to ask. And also, what are the alternatives? So, in this case with cord clamping, you really just have the option of waiting a little bit, waiting a long time, or not waiting and just cutting immediately. So, the alternatives are not too many alternatives, but it's always good to know what other options there are that might achieve the same outcome. So delaying cord clamping, for example, not a lot of alternatives that will give you the same outcome, but it's helpful to know, you'll if you want to delay cord clamping, the benefits are more blood flow to the baby, more oxygen to the baby, vitamins, stem cells, all the good stuff. 30% of the baby's blood volume is still in the cord when the baby is born. So if you wait even just 1 minute to clamp the cord before cutting it, the baby gets 30% of their blood back. And that blood is rich in vitamins and nutrients and oxygen and stem cells. It's all really, really, really good stuff for your baby. So those are the benefits. The risks, in my experience and in my research, I don't see any risks. There are no risks to the baby as far as I know. There are no risks to you as far as I know, unless there are other circumstances. So a time when I have seen a risk is if the baby is born and they're having difficulty breathing. Maybe if they're not breathing right away, or they haven't um, normally what happens is the baby will have a reflex to start breathing air, because up until the time the baby is born, the baby's breathing oxygen through the placenta, through the cord. And then when the baby comes out and is in the room, the temperature of the air, not being in the amniotic sac, there are certain things that happen that tell the baby it's time to breathe through your lungs now. And so if that's not happening, if the baby didn't take that cue, and they're not breathing through their lungs very well, then it might be a risk to delay cord clamping, because the priority at that point is helping the baby to figure out how to breathe. And so they'll want to cut the cord and take the baby to another station where they can help get the baby breathing. So that might be a risk. Alternatives, you can wait or you cannot wait. That's really all there is. I don't think you're going to get the same outcome of getting all the same blood volume and nutrients and vitamins to the baby if you don't wait. Um, Another question is, what does my intuition tell me? So that's a really good question. It's really about following your gut and trusting your own innate knowledge as a woman, as somebody who is birthing your baby. What does my gut tell me? What does my heart and my spirit tell me is the right thing to do for my baby? And sometimes your intuition's telling you nothing. Sometimes you don't really know because you don't know enough about it. And that's why you're asking these questions to your doula, to your doctor, or your midwife to help your intuition know what you should feel for yourself. And then the last question is like, okay, well, what if I do nothing? Or what if I say not yet? As in, I don't want to make this decision yet. Or if I do nothing. So, in the case of cord clamping, if you don't make a decision about cord clamping, and if you're having your baby in the hospital, what will likely happen is they'll probably clamp and cut the cord within about 30 seconds. I think that's the most they usually wait, unless you tell them you want to wait more than that. Sometimes it's shorter depending on your hospital, depending on your doctor. Sometimes they wait longer, sometimes they just want to cut it right away. So if you do nothing, or if you say I don't want to make that decision yet, that's probably what they're going to do. But it's good to know, if you don't do anything, if I do nothing, what is it that they do? And it's important to know that. So that was just one example, and you can see how making a birth plan might take a long time. It might take more than one conversation with your doula to put together a full plan for your birth. Because if you're going through all of these questions for all of the different options and opinions that are thrown at you about birth and throughout your labor, it might take a while to get through it, but it's all very worth it. Like, taking that time is very important because you're learning about everything along the way, and there is a lot to learn. But the good news is that you've done the right thing in hiring a doula, because your doula has all the answers for you, and you're attending this lesson, this call today. So that's really helpful as well, that we can even just start the conversation here. So that's what I would say is something to keep in mind, is this word brain, and helping you to remember these questions that you should ask. So now I'm going to talk about the first part of planning for birth, which is planning for your labor. So there are three, I would say three parts, and you'll see part two and part three next, of course. But the first one is labor. Part two is the birth itself. And part three is immediately after birth. And the reason that I split it up into these three parts is because there are many options, there are many options and many things for you to consider at these three different stages. So it's easier to break it down and think, okay, let's just talk about labor first. What are some of the things I can think about? What are some of the decisions I should make about what I want my labor to look like? And you tackle that as part one. And then same thing for the birth itself and for immediately after the birth. So we'll start here with labor. So I have a list here of things that you might want to consider as part of your labor. Questions that you either want to ask yourself or ask your doctor, your midwife, or your doula, and a lot of it is just yourself. So first thing here is epidural or medication to manage pain, and this is very personal, I would say. It really depends on what you feel like. As a doula, sometimes I will ask my clients, before you got pregnant, what do you do to manage pain? If you have a headache, if your back is hurting, if you hurt your ankle playing soccer, whatever, how do you manage pain? Do you quickly just take an Advil and go lie down? Do you walk it off? Do you do yoga? Do you just drink some water and hope it goes away? So normally, helping me understand how you manage pain outside of pregnancy helps me get an understanding of how you might want to manage your pain during pregnancy and during labor, and knowing that you have those options. So, so yeah, I would say that's one thing that you definitely want to consider about labor is, okay, do I want to manage it with some kind of medication, or an epidural, or do I want to manage it naturally? So that's kind of the the two sides of that coin, is like managing it naturally or managing it with medication or an epidural. Both things are perfectly fine, whichever you decide to go ahead with. I know you mentioned earlier that you are hoping to have a natural birth, and I know that it's possible. I know that you can do it, but I know that it might feel a little bit scary or stressful too. So it's important to really think about those questions that I asked you before. What are the benefits? What are the risks? What are the alternatives? What does my intuition tell me? What do I really want? It sounds like you want a natural birth. And what if I do nothing? What if I just let it happen the way it happens? What's going to happen? So another thing that you might want to consider is Pitocin or other methods that might help to speed up labor. So Pitocin is, have you heard of Pitocin? You can nod or shake your head. Yes, you know Pitocin. So it's like oxytocin. It's oxytocin is a natural hormone in your body that gets labor moving. Sometimes in the hospitals, they want it to speed up. So they'll administer something called Pitocin. It's like artificial version of it, and it really just gets things moving. And so that's another thing you might want to ask yourself and your team about if it's the right thing for you to do, or if you just want to let labor progress on its own. It might take an hour, it might take 13 hours. You never really know how it's going to be. And your decision can change along the way. So if you think, it's been 6 hours and I haven't dilated anymore, maybe it's time. Maybe I should, do something to augment this, to make it happen a little bit more quickly. And so that's going to be part of your birth plan, is saying, okay, at what point during my labor do I want to use something else to keep it going faster? So that's part of the conversation that you have and part of the questions that you ask yourself and your care providers. Fetal monitoring is another thing that you might want to make a plan for. That's putting the fetal monitor. So in hospitals, they have a fetal monitor that measures the heartbeat of the baby. That when you go into the hospital, they just put it around your belly and they connect it to the machine, and then it's just monitoring the whole time. That's called continuous fetal monitoring, where the monitor is on you from the time you get there until the time the baby is born, and they are always tracking the baby's heart rate, and they can track you at the same time. So they're watching your contractions, and they're seeing how you are handling the contractions and how the baby is handling the contractions based on the baby's heart rate. So that's what fetal monitoring is. You might also choose to do intermittent fetal monitoring, which means that it's not continuous. The monitor is not on you 100% of the time, but maybe every 10 or 15 minutes, the nurse will come in and say, okay, let's check the baby's heart rate now. And then they check it, they see everything's okay, and then they leave. And then 15 minutes later, they come back and they do it again. So that's another option as well. Again, I'm not going to go through, we'll be here for a very, very long time if I'm going through all the benefits and risks and everything of all of them. But the my intention in showing you this list is to get you thinking about some of the things that you might not know much about that you can take back. Excuse me, I'm going to drink some water. Sorry about that. So my intention here is I'm putting a little list of things for you to think about. If you don't know enough about it, you can take this back, talk to Clay about it, and learn more so that you can make a better decision. But these are the things I would say that are top of my list when I'm having my conversations with my clients, when we're making a birth plan. These are the things that I want to know about. I want you to make a decision about these things before the time comes, before it's the big day, because when it's the big day, you're not going to be making decisions. We want you to do it before. And these are the things I think that are important to think about. Another one you might want to consider is laboring in or with water. So if you have, if you're giving birth at the hospital, if they have a birthing pool or a big bathtub, if that's something that would be interesting to you, if you want to sit in the water, that's something that you can talk to your doula about. Even with a shower. So I've seen that it can be very, very helpful to sit in a bathtub with the shower kind of running on your back. Can make you feel really nice, kind of giving you some heat. The heat really helps, but also the feeling of the water on your back is kind of like a little massage too. Water has been known to be very helpful during labor and during birth, whether you're submerged in water, meaning if you're in a pool or in a tub, or if you're just standing and there's water coming on you from a shower or something like that. It's very calming, very soothing. It has been shown to lead to positive outcomes laboring with water. Some people, it's not interesting to them. Some people don't like being in the water. I have a friend who has very dry skin. You know, every time she takes a bath or a shower, she has to immediately put cream on, or else her skin gets really itchy. And during labor, that might be difficult. You might not have time to properly put your cream on after you get out of the water, so it's best to just not do it at all. So these are the things that we consider, right? Another thing about labor is deciding where do you want to labor? How long do you stay at home before you go to the hospital if you're giving birth in the hospital, or do you labor at home? And if you do, when do you go to the hospital? At what point? And with movement, or if you want to stay in the bed. So movement has been shown to help labor progress. The more you move, the better it is. You're getting baby in the right position to be born. You're better able to manage pain the more you move. If you have an epidural, then just if you want to lay in the bed and maybe take a nap between contractions, you can do that as well. So there's lots of options here. And like I said, you just want to ask yourself and your birth team the right questions. So that's it for labor. Before I move on to part two, talking about birth, do you have any questions, or is there anything here that you want to discuss?
Yeah, like you made me think a little bit when you said about the medicine, how I kill my pain, right? A painkiller or something like that.
Mhm.
And I am a person that even though I am choosing to go for a natural delivery without no medication whatsoever, um, everything I have, I take a painkiller. Like
Okay.
I hate, I hate to feel sore. I hate even a headache or like I don't know any type of sore. I don't like it.
Mhm.
But during the pregnancy itself, I've been told that I can't take any medicine, right?
Right. Right.
And because I've been told that, I actually kind of like configured my mind that
Not an option.
like no medication at all. Like
Hmm.
I had an event. I went to Brazil to visit my family there, and was the first time that I actually had vomit during my
Oh,
entire pregnancy. So far,
wow.
it's only that time. And I felt sore in my belly and was very swollen and like in the pelvic area, very sore too. And they said, well, it's better to go to the hospital to take a look at that because we don't know if I
Yeah.
had anything, right? And when I arrived to the hospital, the doctor asked me, do you want to take any medicine now in your veins? And then I look at him, I look at my husband, and I said, I think it's better to not take anything just because I got used to that here in Canada. And then he gave me like out of the counter type of medication just to compose my floor again and things like
Mhm.
that. And then I said, okay, so this I am okay of having. And even like that, I reframed myself a little bit of really getting to that. You know what I mean? Like I took, but I didn't take everything he asked for. Like I take one or two and said, if I get an improvement, I'm going to stop, see how I react. And then if you need, I take more.
There you go.
So you actually made me think about it because like I had few events of really have type of migraine, which
Yeah.
I had never had before in my life. I had for 15 days during the pregnancy.
Oh no. That's hard. That's really hard.
That was like kind of killing me for real. I couldn't think anything. Like I could rationalize anything, even in my job, like a simple math.
Yeah.
I got it to my husband and I said, hey, can you help me with this? Because I can't move. Like I'm 2 days thinking about it and I don't move the calculation.
Hmm.
And then he looked at me, Anita, you should learn this when you're a kid. I said, but I can't think. So
I know exactly what you mean, and it can feel sometimes like it's just too much. Like
yeah.
my
But
brain can't do anything else.
but in fact, like for the labor part, I was considering to have the epidural.
Hmm.
just because it's normal in Brazil too, and people have that all the time and things like that. But once I saw some videos about it and I read a little more, I kind didn't see really the benefit of that. Like
Right.
other than just killing the pain, but maybe like in my head, okay, I take that, and then I cannot feel my legs, I cannot feel my vagina, I cannot feel the baby being delivered. Like
Hmm.
I don't know if I can have control about my body to push enough the baby, or if I have still to take any other medicine to kind of improve that in somehow. And then I look at my husband, I said, well, I don't see any benefit of that. And he started to laugh. He laughed a lot. I said, you don't see benefit? Like it's gonna kill your pain. I said, but that's all. And what is the remaining part of that? If anything happened to my baby, how can I believe and feel that I have a little bit of the control myself, to help my baby to get off quickly, like, or
Hmm.
as soon as possible.
Yeah. Yeah, good. That's a really good way of thinking about it because you're right. The main benefit of an epidural is that you don't feel the pain. But if that's the only good thing that it does, is it enough for the things that aren't so good? Like you said, your legs, like no feeling. Will you be able to push properly? Will you be able to do anything really if in the moment if you need to, you might feel more confident. Maybe you'll feel some pain, but you'll feel more confident that you can be in control more of what's happening. So that's a good way of thinking about it. It's like, yeah, okay, it takes away the pain, but how important is the pain compared to everything
Yeah.
else?
Yeah. One question I have, I don't know if it is in this part of labor. I think is when I already delivered the baby, but like the cord clamp that you gave the example, right?
Hmm.
I choose to wait longer,
Yeah.
but I don't know if they will ask me for how long I want to wait, or if they will tell me how long they can wait.
Yeah, it's always a good idea to have, and this is something you can talk about with Clay. Like Clay will help you to determine what is a good amount of time for you to wait. But it's always, I think, a good idea to go in with an idea of how long. So you might say, I want to wait 1 minute, or I want to wait 2 minutes. Even 2 minutes is a good enough time to get your baby what the baby needs. But more important than the time that you wait is what the cord looks like. So I
Mm,
always say we'll talk about cord clamping later, but I mean we'll talk about it now because we're on it. But the thing that I always say about cord clamping is wait for white. So the cord, when the baby comes out, the umbilical cord is like purple, blue. It looks like a telephone cord. Like it's rings like this, and it's very thick. As the baby is getting all of the blood and everything that it needs from the cord, it starts to turn white and it gets thin. That's the time when you should clamp it. That is the indication that the baby has received everything it needs to receive from the placenta, from the cord, and then it's a good time to cut. Sometimes it takes 30 seconds, sometimes it takes 6 minutes. Every baby and every body is different. So that's why when it comes to delaying cord clamping, I like to say wait for white. And
mhm,
that's what and it's very important when you're making your birth plan or you're thinking about what are my wishes for my birth, be as specific as you can. In all of these things, try and be very specific because if in the moment when you're in the hospital, they want things to happen quickly. That's just the truth. They just want to happen, they want to get you in, get the baby out, then get you out and then, keep going. That's kind of how they operate there. So their instinct might be to cut the cord right away, depending on the hospital, depending on the doctor, the nurses who's in the room. But if you are clear and specific about what you wish early and you let them know it's very important for me, if there are no other indications, like if the baby's not struggling to breathe and there's no other risks, if everything is okay with me and with the baby, I would
mhm.
like to wait until the cord turns white before we cut it.
I got it.
And that's
And
the
and and like we are debating if we should save the cord blood for donation or for ourselves.
mhm.
Most likely, we're gonna put it in for donation, right? But I don't know if I choose to save the cord blood for that reason, if that will impact in another decision, such as the delayed cord clamp, or putting the baby right away on my chest and have skin to skin and breastfeeding and things like that. Because
Yes.
I don't want to take my whole experience of doing all these other things to keep like
One
saving my
thing.
cord. You know what I mean? Like,
Yeah, I know what you mean. Sorry, I know what you mean, and I think it kind of depends too. You don't know how long your cord is. You could have.
just 1 minute.
Yeah.
Yeah. Sorry, my kid is yelling in the washroom. I asked my husband to go and help. But yes, so sorry to interrupt you.
No, that's okay. I was saying you don't know how long your umbilical cord is right now because it's inside. So you don't know if the baby is born and the cord is very short, you might not have the space for a baby to stay connected to the cord and be skin to skin. So maybe
Mhm.
that will be the deciding factor for you to cut the cord sooner rather than waiting so that you can do skin to skin if that's more important for you. So that's the things that we're talking about today. I don't expect you to make a decision about these things right now because there's so much to know about every single one of these things to help you make a decision. But this is more of like, oh, hey, here's a reminder. Here's something I want to know more about. So I talk to my doctor or my midwife or Clay, or I do a search or whatever. Um, so in that case, for you, if you decide to save some of the cord blood, first you want to find out, okay, what are the benefits of saving the cord blood? What can I do with it? How do I store it? Do I give it to, the storage facility? Do I keep it myself? um, if I do keep it, what can I do with it? When will I use it? So there's a lot of questions that you want to ask yourself and to ask the people who know about this, who are supporting you. um, and then, like you said, sometimes if you make a decision about one thing, it impacts your decision about another thing. So that's when, for you, it becomes about prioritization. You have to decide what's more important for you. So, in a situation where you have a very short umbilical cord and you can't bring the baby to your chest while he's still attached because it's too short, then you have to think, what's more important to me? Holding off on cutting the cord so that the baby gets all the blood and everything from the umbilical cord? Or is it more important for me to have a baby on my chest and to initiate breastfeeding immediately? So, and there's no right answer. It's really just about what you feel and what's going to be right for you and for your baby and for your family. But these are things to think about and to talk about with Clay. Clay will be able to help you talk through these decisions in a way that will make you feel like you're making the right decision for yourself.
Yeah,
Okay. I'm
difficult.
gonna. It is. I know. It's so hard. There's so much. um, but imagine doing it without a doula. Like imagine trying to think about all these things and you didn't have somebody who knows about it. Like I don't even know where I would begin.
Yeah,
Uh,
that
I'm
is
I'm
true.
I'm gonna move on to part two now. So the birth itself. This one's important. So and again, I know I've already said this a lot in the beginning, but I'm going to say it again, that you make your decisions now based on what you want, but understand that it's important to have plan B or plan C, or backup to your backup to your backup plan. For example, in the first thing on the list here, you see vaginal birth or cesarean. You might choose that your wish is to have a vaginal birth, but in the moment maybe there's a complication, or the baby didn't turn and is not in the right position, or something maybe has happened that it sounds like the best option at that point is a cesarean. Then you have to make your decision at that point. Okay, do I still try for a vaginal birth even though it sounds like a C-section is the better option, or do I just go ahead with that? So it always helps you to have a backup plan. And so even if your plan A, or your wishes to excuse me, to have a vaginal birth, and maybe that's what is going to happen, it's still important for you to have a plan it's a C-section. So if it is a C-section, here's how I want everything else to happen, because it will look very different from if you have a vaginal birth. All of the other decisions that we made about cord clamping and skin to skin, it's going to look different if the baby is born via C-section. So you have to make another plan about those things as well. If it's like, if you make like a flow chart and you say like, okay, here, if it's vaginal birth, then this happens and this happens and then this. If it's a C-section, then this and then this and then this. And it kind of evolves, it changes. So it's important to think about, okay, here's my number one, my goal. But if I can't achieve that, what will be the next best thing, and how do I want that to look? So that's just a note about how to plan for plan A and plan B and plan C and everything else. Um, Episiotomy. So I don't know if you know much about episiotomy, but it's if you are having a vaginal birth and if the baby is stuck, maybe they'll ask if you want an episiotomy, which is when they cut a little bit to help the baby come out, and then they stitch you up. Normally, the doctors will say, well, we're probably going to have to stitch you up anyway, so it's easier if we make the cut so that it's clean, and then you'll heal better because it's just a clean cut instead of a rip or a tear that will happen from the baby pushing out. It's always your choice. The doctor is never going to, the doctor should never do something without getting your consent. So it's important to know episiotomy. What are the benefits? What are the risks? What are the alternatives? If I do nothing, what happens? So very good to keep that in mind. And maybe that's a conversation you can have with Clay as well about if that is something that's required, what will tell the doctor that's required? How will we know I need one? And if I do need one, do I really need one? Or is it just making it easier for the doctor? So you have to ask yourself and your doctor those questions too, and know for yourself if it's something that you want. Most people don't want it. Most people don't want someone to cut them down there. It's not, you don't feel it. They'll numb the area first. They put a needle to numb it and then they'll cut. But it makes healing a little bit more difficult because you're definitely going to have stitches and it goes through all the tissue. So it's um, a little bit more intense, I guess I would say. So that's something to think about if that's what you want. But sometimes, I mean, the reason why they do it is because it helps the baby to come out quicker, helps the baby, helps you meet baby sooner. So again, it comes down to priority and to personal preference. Is it more important for me to keep trying to push, or is it more important for me to just get the baby out now? And sometimes when you're asking about what are the risks, sometimes maybe the baby's shoulder can be stuck. And the only way to get the shoulder out is to make a little bit more room by making a cut. And then the baby comes out and the baby's fine and you get some stitches. Maybe that's, that's the reason why they're going to go for that. So you have to, in that case, it would be an in the moment decision. But knowing about what an episiotomy is before you're in that situation will help you to make a better decision in that moment. If it happens that you need one, you know what it means, you know what the healing will look like, you'll be more informed, and then you'll feel more confident in your decision. Instrument assistance. So instruments are things like forceps or a vacuum to help baby come out. So same thing like I mentioned, if maybe the shoulder is stuck or if the baby's, turned in a strange position and it's difficult for the baby to come out, the doctor might say, okay, I think we need to use the forceps. Forceps look like very long scissors almost, and it clamps the baby's forehead and then pulls the baby out like that. I haven't seen forceps used myself in the babies that in my clients I've supported. I haven't seen anybody use it. I don't think it's used as commonly anymore as it was maybe 20, 30 years ago, but it's not unheard of. Sometimes it happens. So it's good to know when in what circumstances would I need the forceps or the vacuum. The vacuum is like a little thing that goes on the top of the baby's head and it gets suctioned on and then it pulls the baby out using like vacuum force. Same thing. I've never seen it happen, and I don't think it happens as often, but it still happens if it's needed. So it's important to, some of the questions you can ask your doctor and Clay would be, why would I need that? what situation would happen that would make sense for me to say, yes, let's use the forceps, or yes, let's use the vacuum. Um, what are the alternatives? Okay, if I don't want to use it, what else can I do? Can I just continue pushing? Can I change my position? Maybe depending on what the reason is that the doctor says you need to use it, maybe you just need to do some jumping jacks. Maybe you just need to get off the bed and move your body a little bit, and then the baby turns and everything's okay. So those are some questions that you can ask when you're deciding, do I want some kind of instrument assistance, or are there things I can do before we get to that point? Maybe it's a last resort, or maybe it's a definitely not, under no circumstances do I want that. Or maybe it's like, okay, let's say no until it's an absolutely necessary last resort, then we'll do it. Choice of pushing position. So if you do have an epidural, you won't have a lot of choices because you'll be numb from the waist down. So you won't be able to stand. You might not be able to lay down on your side. So if you have an epidural, your choices are limited. If you don't have an epidural, then it's up to you to decide what position you want to be in when it comes time to push. I always recommend a squatting position. It's the Historically speaking, it's been the most effective way to get a baby out, is to be squatting. Think of it this way. You want to use gravity to help you, right? The baby coming down. So if you're laying down on your back, that's not, gravity is not working with you. You're kind of working against gravity. So, but that is the most common way for people to give birth, because in the hospital, the doctor says, okay, lay down, and I'm going to be right here watching baby come out. It's easy for them when you're in that position. But for you, if you want to decide, you know what, I want to have my own choice of the position that I'm in because of how it's better for me, how it's better for the baby, how it will hurt me less. Maybe it will um, reduce the amount of tearing that I have. These are some things you can talk about with Clay. She can help you learn about different positions that you might want to try when it comes time to push. In the hospital, they have something called the squatting bar or the birth bar, and it's an attachment that goes on the bed, and it's a bar that comes across the bed. So what you can do is you can kind of stand on the bed a little bit in a squatting position and lean on the bar, but you're still in the bed. So if the baby comes, the doctor's right there, and it's better than, going on the floor or something. You're already on the bed. So you might want to ask at the hospital, can we have the squatting bar? That's a tool that you might want to use. Or even on all fours, like if you go on your hands and knees, that's another really good position to be in when it comes time to push, because your hips are open, your pelvis is open. It creates a good space for your baby to come down. If you are on your back, if you are going to be laying down on your back, because that's what you choose, or because you have an epidural and that's what the doctor says you have to do, it's a good idea to put like I don't have anything here with me, but like a towel, roll the towel up into like a C, and put it behind your pelvis, kind of just under your bum. And it lifts your bum a little bit to help the baby kind of slide out. Instead of being flat on your back, you're going to be kind of lifted like this, and the baby can slide a little bit better. So that's a good thing to remember. And I'm sure Clay will go over all of this with you when the time comes, but that's something you might want to think about too. If I have to be on my back, how can I make it work better for me? There's an option. Another thing that sometimes people think about is, if I'm giving birth in the hospital, do I want there to be students in the room, people who are learning how to do this? So it's every time it's a personal choice. It's up to you. If you don't like a lot of people in the room, it's a very intimate moment. There's a lot going on. The machines are beeping and you're screaming, and there's a lot going on. Do you want extra people in there learning? Or do you want to say doctor and nurse only, and that's it, and my doula and whatever? That's up to you. And again, I don't think in that case, for that question, there's not really benefits or risks, or there's not too much to consider except for how you feel. And it's important to consider that. So think about how you want that moment to look.
Yeah, so talking about this specifically, I consider no is a no, because it's a life, and it's two lives, mine and my baby. So But because I have a fear in my head, and it
Hmm.
might just exist in my head, but I have a fear that if I say yes, they probably will provide me personnel from the hospital that are students rather than the ones
The
who has like
doctors.
a graduation and experience in that matter.
Yes.
So just because of that, because I'm a huge fan of people learning and everything else, even for the Mama Doula, I actually said that I would be fine if some students come along with the sessions that we have and things like that
Right.
for training purposes, right? Because I believe in training purposes, and everything I do in my life, one day I have to try for the first time too. But
Yes.
but then I was thinking, oh, but this is a life, you know what I mean? Like,
It's important, absolutely. And like I said, there's no right or wrong answer. It really comes down to how you feel and what's important for you. And and that's a perfectly valid answer that you said just now. It's, it's a life. It's my life and it's my baby's life, and I want to feel secure. I don't want this to be your first time.
yeah, yeah.
So that's perfectly normal.
But Caitlin, like I have a question about the episiotomy.
Yes.
Um, does that procedure will happen no matter what? Like,
No, no, no. It's not um
I mean, or naturally, me by myself open up like right, like ripping off that by myself or with a doctor interference procedure.
So you can talk to Clay about this in more detail. She'll tell you exactly, what are the circumstances when that would happen. But no, let's say, for example, so the episiotomy is specifically just when the doctor actually makes a cut on purpose.
Okay.
If not, if you don't do that, you might tear on your own just
Mm,
because of the force of the baby. Here's the baby's head and here's your opening. It's tight. So you might tear on your own. The episiotomy, sometimes it doesn't they don't do it very much anymore unless there's a specific need for it.
need
Like I
for
said, if the baby's shoulder is stuck or if the position is strange and they're not getting the baby, they need a little bit more room, then maybe they'll ask you. They must ask you. I think the right thing to do is to cut you and to make an episiotomy. Do I have your consent? That's what they should say. I've never seen them do it without asking you.
okay.
They'll never do it without asking you. They have to ask if you consent. In that case, they might tell you very quickly, the reason why I think we need to do this is because the baby's shoulder is stuck and we need to create a little bit more space for the baby. And then you can say,
That's a need, yeah. It's very
yeah, based on the conversation that you have with Clay and the research that you do and the decision that you make ahead of time, you'll know, okay, in my birth plan, if they ask if I want an episiotomy, do I say yes or do I say no based on what the situation is? So you kind of have to use your imagination a little bit until you're in the moment. And then when the moment happens, then you know what your answer is going to be.
but I think you gave a good idea to have two birth preferences folder. One
Yes.
vaginal delivery and the other one cesarean. Because if that goes to cesarean, I'm fine to have that dural. So I'm
Exactly.
not
I
gonna
hope
feel
so.
anything. You know what I mean? Like, so give it to me.
Absolutely.
Like, I don't want to feel the cut on my belly. Like, so
No, no, and that's what I meant when I was saying, like, the decisions that you make based on it being a vaginal birth, those decisions don't matter anymore when it's a C-section. So you have to make new decisions about those things if it's a C-section. So that's why it's very important. Make two plans, make three, make four, make as many plans as you need to so that all of the scenarios are covered. Any just in case, it's covered.
and then we deliver all of them to the doctor when arrive in the hospital.
I think when you are having at the end of the pregnancy, you'll be seeing your doctor, I think, once a week for the last maybe 4 weeks or so. Start talking with your doctor about your plan so that your doctor's already familiar with the things that are very important to you. You don't need to go through every single line of your plan, but start talking about the things that are most important to you right off the bat so that they're already familiar. They already know kind of what is important to you so that when they're there with you for the birth, they know what's important to you. But maybe your doctor's not working that day. When you go into labor, maybe your doctor's not there. Maybe they're on vacation. Maybe it's their day off. That could happen. So in that case, it is important to have a birth plan that you can give to the nurse that's on duty or to the doctor that's there. But having Clay with you will be helpful too, because Clay knows what's really important for you. And if you forget something, she'll remind you.
Okay, yeah.
Yeah.
Yeah, in my case, it's gonna be the midwives,
Oh, perfect.
yeah, but I was okay. The midwife might get to know better what I want, but
Yeah.
if any procedure is different, it's gonna be different, and they need OB. I don't know if like how they will handle everything to the OB itself.
Hmm.
You know what I mean? Like, should I handle all the birth preferences to the OB, and the OB might read wrongly and see, this is the information. You know what I mean? Like, so
You know what? I think the birth plan is more for you than for anybody else. As long as you are you know every part of your birth plan, you know your wishes, you know everything that you want, that's the most important thing. Because in the moment when things are happening, you don't want to make the decision then. You want to make the decision now so that you don't have to think. Remember when you had a migraine and you couldn't do basic math? That's what it's going to be like during birth and during
birth.
labor. You're not going to be able to think about these things. So knowing now what an episiotomy is, you can make your decision now. But if you didn't know that it was an option, if you didn't know what an episiotomy is, and you're there and the baby's shoulder is stuck and the doctor's saying, okay, I think I should cut you. I think you need an episiotomy. And you're thinking, what is that? Why are you going to cut me? Oh my God. You start to panic and freak out because you don't know what it is.
Mhm.
But now you know what it is and you've already made the decision. So you're not going to panic. You're not going to freak out. You already feel confident in the decision that you made to say, okay, that's fine only if it's necessary. And that's it. And then the decision is made. So what I mean by that is it's more important for you to be comfortable with your birth plan and know your birth plan inside out so that you're not making decisions in the moment. The doctor, maybe they're delivering 6 babies that night. They're not keeping track of everybody's birth plan. They're just getting it done. But for you, you can say, actually, I want to delay my cord clamping, please. Actually, I don't want an episiotomy. You're there to speak up for yourself because you've already made your decisions. You're not thinking anymore. You're just answering.
Yes,
Yeah.
yeah.
Okay, let's move on to after birth. Um, so these are some things we already talked about delayed cord clamping, so I'm going to skip that one. But you also might want to think about, okay, do I want to start breastfeeding immediately? Is that something I want to try right away? Do I want to wait a little bit before I try? Do I want to not even bother with breastfeeding? Do I want to give them the bottle and the formula right away? That's all up to you. There's benefits and risks to everything. I don't think in this case really there's much risk at all. Whatever you choose, at the end of the day, you want your baby to be fed and you want your baby to eat. Um, there normally in the hospital you might have access to a lactation consultant, so even if the baby does latch and you start breastfeeding, I think it's always, if the option is there for a lactation consultant to see you, always take it. Always say yes, please bring in the lactation consultant. And even if everything's going perfectly fine, they can look at you and say, yes, the baby's eating, the baby is latching properly, your milk probably won't come in for another 3 or 4 days maybe, but the baby's doing what it needs to do and your body is getting the signals that it needs to start creating the milk. Perfect. Or maybe the baby is having trouble latching. Maybe it's really painful for you. Maybe something's not working out and you're worried that the baby's not eating. The lactation consultant can see what the problem is and help you maybe position the baby better or position yourself better. So having that person there, and Clay will help you with this too. I know Clay is very experienced in that area too. So it's, again, going back to the birth planning your wishes, just know in advance, what is my ideal situation? If I want to try breastfeeding immediately, then you do that. But if it doesn't work, what's my backup plan? What's my plan B? Do I just keep trying? Do I do formula? Do I use a bottle? Know what your options are and then make your decision. Stitches. So like we were talking about with the episiotomy, when they cut you, then for sure you're going to have the stitches to close you back up. Sometimes if you don't get an episiotomy and you just tear a little bit naturally, the way, because the baby coming out is going to make you tear, do you want sometimes they the doctors or the nurses will tell you you need stitches because it's a 3rd-degree tear or a 4th-degree tear. That means it's gone through so many levels of tissue. Sometimes it's very superficial where it's like it's bleeding, but just like, you got a paper cut. Like it's very on the surface of your skin. You can choose to get stitches there to close it up or just let it kind of heal on its own. So you always have the option, but it's always important again to understand what is the benefits? What's the risks? What if I do nothing? What was my intuition telling me? So stitches is something to think about. What I will say about stitches is if you tear, if you have an episiotomy, if you do end up getting some stitches afterwards, when you're wearing the like the adult diapers, or if you have some pads that you're wearing, I know Clay will probably help you make a pad that has aloe vera and witch hazel. And that helps. You can keep them in the freezer. And then when you need it, you take it out of the freezer and it's nice and cool and it feels really healing. And the aloe vera and the witch hazel is going to help you to heal faster. Just make sure that the pad that you get doesn't say dry weave or dry fit, because if it says that, it stays dry, which feels nice. You're not, sitting in blood or anything, but it might be too dry and it might tug or pull on the stitches a little bit, and that might hurt. So just make sure. I know Always, the brand Always, they sometimes make it so that it's that dry fit, which most of the time it's nice. You want it to be dry, but when you have stitches there, you don't want it to be dry because it will pull and that will hurt. So keep that in mind. Birthing the placenta. So after the baby comes, you're gonna be, oh my God, the baby's gonna come. The baby's gonna start crying. Maybe you put the baby on your chest right away. Maybe if baby needs some help to breathe, they're gonna take the baby away and help the baby breathe. The next thing that happens is you have to get the placenta out. So that's something that you can talk about with Clay in more detail, because it's a big. She'll teach you more about what happens, but essentially, after the baby is born, the doctors or the midwife in the hospital will start to push down on your belly to encourage your uterus to shrink back to its normal size, but also to get the uterus, or sorry, to get the placenta off the wall of your uterus so that it can come out. It doesn't feel very good. It's called a massage, but it doesn't feel like a massage. It hurts. It doesn't hurt. Pain is relative, but it's not comfortable. I'll say that. It's not very comfortable when they're pushing, and especially after you've just had so many contractions, you're feeling kind of sore. So it's good to be prepared and know that this is not going to be a very comfortable massage, but it's going to help to get the placenta out. There's really not much for you to do. You won't have to push the same way that you pushed for the baby, but your uterus is still doing contractions. Even after the baby is out, you're still going to feel contractions because your body knows, I still need to get this out. I still need the placenta to get out of me. And so your body will do the contractions for you. I don't think there's much um, decisions for you to make about that. There's really nothing for you to say, oh, I want to do this or I don't want to do that. It's more something for you to just know about and understand, what does the process look like for when it comes time for me to birth the placenta. Because I
Yeah.
think what happens is the baby comes out, and before you're giving birth, you think, okay, the baby's out, okay, that's great, yay. But there's still more work to do. There's still more stuff that needs to happen after the baby is out. So it's important to know about that side of things too, that there's more and you still have a little bit more work to do.
Yeah, this example you are giving about the birthing of the placenta with the massage and things that they do, is that what they name as active management for placental delivery?
Yes.
But for that one, is the one that we take a medicine on?
Sometimes they will give you Pitocin. So I think here in the beginning, I talked about Pitocin. So they use Pitocin to help you speed up labor, but also after the baby is born, they might give you Pitocin to help speed up the delivery of the placenta too.
But if I say that I don't want active management for placental delivery, and I want to naturally,
Then that just means it will come out on its own when your body when it comes out on its own without them. They shouldn't ever be tugging, but they might massage you and kind of move you a little bit to help it come out. But if you don't want that, that's a decision that you're making now in advance. That's it. You just tell them, no, no, thank you. The baby's out. This will come out when it's ready. And you have to just
okay.
be, but you have to be very clear, because like I said before, in the hospital, sometimes they just want things to go quickly. They just really want to get you moving. So they might say, no, let me help you. It'll be better if I just, give you a massage and help it come out. And you say, no, it's okay. Just don't be afraid to be strong with what you want. That's a very important thing. And Clay can help you with this. And your partner, your husband can help you too. Whoever's in the room can say, no, she doesn't want that. Like, you know. So um yeah. And then the last thing here is skin to skin. So we talked about putting the baby on your chest immediately. A decision that you can make there is, do you want them to wipe the baby off immediately? When the baby comes out, there might be blood, some amniotic fluid, some like white creamy substance. It's called vernix. That's like vitamins. It's like Mother Nature's skin cream. It's already on the baby. So the doctors might just start wiping the baby to put the baby on your chest. Or you can say, no, I don't want the baby wiped. Just put the baby on my chest with everything. That's okay. And that's up to you if you want that or not. Again, no right or wrong answer. It's just your personal preference. But there have been shown to be benefits of not wiping the baby, because the baby through the skin will still get all those nutrients. And but there's no harm in wiping the baby.
Mm-hmm.
So it's totally your preference and what you decide to do. And then you can also decide, when do you want the baby's first bath. Usually, I think, the baby can go maybe like the first week with no bath, because it's still absorbing all of that good stuff. Yeah, talk to Clay about this too. And you can decide for you what makes sense. Do I give the baby the bath after 2 days, after 1 day, after 6 days? You see what makes sense for you. And when I say no bath, you can still use like a wet cloth, or sponge or something to get like behind their neck, behind their ears, in their arms, that kind of thing. But you're not really putting them in a bath to take everything off. So that's just something for you to consider and to talk to Clay about.
Mm-hmm.
Um, and skin to skin, you decide, do you want to do skin to skin immediately? Do you want to wait a little bit? Do you want your husband to do skin to skin with the baby as well? So those are options that you have, and that can be part of your birth plan too, is deciding if you want to do that, if you want both of you guys to have some time doing skin to skin, if it's just you, if it's just your husband. And then again, also considering, okay, that's if everything goes to plan, if there's no risk, if everything's good. If the baby, again, I'm just making the same example, if the baby's having some difficulty breathing, you won't have the option to do skin to skin, because the priority is making sure baby can breathe. And so they take the baby to their station, they help with the oxygen and whatever. You won't be able to do skin to skin immediately, but you can do it after, and that's perfectly fine. So just knowing what your different scenarios and the different options could be depending on what happens.
Okay.
Okay.
Yeah.
So some other things to consider, that are not necessarily about labor or birth. You want to think about who is your care provider, who's a part of your birth team. And it sounds like you already have that figured out. You have your midwives, you have Clay, you have your husband. Everybody's going to be part of your birth team. But these are things to think about. But you have it done, so that's good. Induction. You If you're going overdue, do you want to be induced, or do you just want to go and see when baby comes? Maybe it's 42 weeks, who knows? Maybe it's 36 weeks, it could be early. So it's up to you to decide really, when is the right time to decide if I should be induced. Because maybe the doctor will say, okay, at 40 weeks and 5 days we're going to induce you. Then it's a good time to ask those questions. Well, what are the benefits of inducing me at that time? What are the risks if I don't get induced at that time? So you ask the questions about that. If induction is something that your midwives start to talk about, I don't think you will. With midwives, they don't usually do induction. But if something happens near the end of the pregnancy and that's part of the conversation, again, this is something you want to think about ahead of time and make your decision now, so that you don't have to make your decision later. And maybe, luckily, if you're lucky, then you don't have to make a decision about it at all, but you already have thought about it just in case. So that's like with everything we talked about. Where you're giving birth, but that's another thing to think about. If it's you're doing a home birth or the hospital or the birth center, but you already have that, think about what you want to wear. Like if you are just going to wear the hospital gown that they give you, that's okay. Or if you want to buy your own gown, like sometimes they have, you can buy online, like on Amazon or something, like a birthing gown where it has like buttons in the front. So when it comes time to breastfeed, you just open the buttons, and it's got buttons down the back. So, you know, it's very versatile. If you feel more comfortable in your own clothes, you can do that. Or if you don't care, who cares about what I'm wearing, then you don't think about it and it's fine. You wear what the hospital gives you and that's it. But there's an option there too. Basically what I'm saying is you have so many options. You can do whatever you want. And then the last thing here is, what are you packing in your birth bag? What are you packing in that bag that's just for you? What are you packing that's going to be for your husband, and what's going to be for your baby when you're taking the baby home? So that's something you can talk about with Clay as well. You know, what are the important things for me to keep in my bag? Your Clay will be able to help you with that. Another reminder, I've said it a million times already, but you want to make these decisions ahead of time so you're not making them in the moment. Because in that moment during birth and during labor, the decision-making part of your brain isn't working the same way that it normally does. So having these decisions made in advance is going to help you. I know I already said this like 100 times, so I'm not going to waste more time here. But you know, that's the whole point of making a birth plan, is so that you don't have to worry about it in the moment. One last reminder that is very important is planning for postpartum. So just the way that you're making a plan for your birth and you have your wishes for what your birth looks like, it's very important to also make a plan for your postpartum, knowing who's going to be there to help you. Do you have family or friends? Do you have your postpartum doula? You know, who's going to be around to support you and to support the baby? Um, and you want to do as much as you can now while you're still pregnant, that will help support your journey. So maybe, you know, you spend a few nights a week making like a big lasagna that you can put in the freezer, so that when you're postpartum, you don't have to think about cooking. The last thing you want to do is get up and cook and then clean up the mess that you made when you were cooking. You want something you can take out of the freezer and put in the oven, and that's it. So those are some things you can do even now before the time comes, so that you're ready. And stocking your bathroom. So making sure, this is later in your pregnancy. I know you're still, you know, 27-ish weeks, I think you said. So you can wait, you know, a few more weeks before you do this, but it's a good idea to start stocking the different areas of your house. So make sure that you have everything you need in your bathroom, everything you need in the baby's room, in your bedroom. And I like to encourage my clients to have like a changing station in their living room or near their kitchen, somewhere where you spend a lot of time, so you don't always have to go to the baby's room every time you need to change the baby. You can have like a little station ready to go near the couch, so you don't have to, you know, get up and go somewhere else with the baby. If you see the baby needs to change, okay, I'm just going to change the baby right here, and then you're done. So just have your different spots around the house fully stocked, fully equipped for what you'll need. Another very important decision to make is, when will you accept visitors? If everybody's going to want to come see the baby, that's what everybody likes. So it's important for you to know, maybe I don't want anybody to come see me or the baby for the first week. Maybe the week is just for us, just for our family, and that's it. Or maybe you want everybody to come and see the baby right away because everybody's so excited, and, you know, here, take the baby, I'll go take a nap, whatever it is. But it's important for you to make the decision ahead of time. So, you know, and to set the boundaries, you know, talk about it now, especially with your husband, have those conversations so that, you know, it doesn't cause any stress or anxiety in the moment when you're like, I don't want anybody to come over. Yeah, but they have to come over. You know, you're not having that conversation, you're doing it in advance. The last thing here is, maybe this one isn't for everybody, but if you feel like you need extra support, maybe hire a cleaning team, hire somebody to come in and do a quick clean of the house once a week or something, one less thing for you to worry about, or even a chef, you know, someone to come and make a few meals for you. And it could be a professional, it could be a friend or a family member, if that's something that you need. If you feel like you don't need it, then you don't think about it, but it's an option for you. But definitely, no matter what, the same way that you have a conversation with Clay about your birth plan, you should have the same conversation about your postpartum plan. It's just as important. And that's everything. I know we've kind of been going through, you've been asking questions as we go along, but now that we're just at the end here, do you have any final questions?
Yes, no, thank you so much. You covered a lot, things that I haven't think about it. It's great actually to have this section.
Oh, good.
But Yes, this situation of allowing people to see the baby right away or not is something that I've been talking with my husband already.
Good.
Just because I have two step kids, right? I haven't had any pregnancy before, but
Mhm.
he was telling me that when he had Julian Samuel, his ex-wife haven't allowed his father and his mother to get in the hospital to see them right away,
Mhm.
and that his father got offended by that,
Yeah.
right? And what I am learning here is, okay, I delivered the babe, my legs are open, I am all messed up, like I don't know how it's gonna be the baby. I don't know if the baby will like cry a lot, or if I'm gonna put the baby in my chest, do skin to skin, showing my breasts. You know what I
Mhm.
mean? Like all that thing that I consider very private.
Yes.
So I already told him, my husband, way ahead. I said, don't take me wrong. I don't want to offend anyone,
Yeah.
but truly, I don't want to see your father next to me in this moment.
Perfectly normal. I think
Right,
that's
and I told him, and even him, he wants to be with me when I give birth. And then I told him, okay, fine, you can be there with me, I want you to be there with me, but I don't want you looking on my
Mhm.
legs, between my
Mhm.
legs, be on my head or be in
Also
my
here.
hands. I don't want you to see that, because this is to me so evasive, like,
Yeah.
and it's kind of you seeing me the opposite side of me, like you open the bag and flip around and
Yeah.
it put me backwards. So I don't want that. Like this is too much for my head, right?
Yeah. And does he agree? Like, is he on the same page with you?
Well, with his father, think he said, Anita, I'm not going to debate that with you. It's your right. I'm going to respect you. I'm going to ask my father to respect you as well.
Good.
But then when it comes to the visiting home, today I
Yeah.
asked that question to him
Good.
because my mom is really constant about it. And she told me, Anita, I think you should carefully consider with Marcus, do not allowing anyone to come in over, because you don't know, like, with who these people were with, like if they are
Germs, if they're
healthy
sick.
of
Yeah.
germs and things like that. And I am like that in my head, like the baby will only see people outside of our family here
Hmm.
when they already had at least the first shot of all vaccines.
Yes.
In
Yeah.
my head, but like in my husband's head, I think he has something else, because he told me, oh, I think we should consider which group of friends we would allow to come to see the babe and things like that. But
Mm.
I think it's gonna be a lot, like, like
I have
to,
to say that's one thing about the pandemic, that it made the decision for you. There was no option. During the pandemic, you cannot come to the hospital. You cannot come to my house. So I'm in my bubble, so it made it very easy for people to say, "Sorry, you can't come see the baby yet because of COVID." But now that we're not in COVID anymore, we have to make these decisions about who do we allow to come see the baby. And it's like, oh, but you let your friends come, but you won't let my friends come. And, it can be some stressful conversations, but you're already having the conversations, which is important. Um, I feel like it's it's a very personal decision. So this is one of those things where you're not gonna be able to do research and say, like, how soon should I have my people come see my baby? Like, it really comes down to what you feel is right, and having the conversation with your husband. And if you're not on the same side of the argument, finding the middle. You have to find somewhere that you're both comfortable, right? But it sounds so far like he's being respectful of your wishes, but I think it's very important for you to stay true to what's important for you, right? Put your foot down when you feel like you need to put your foot down, and listen to him too. He has, his wishes are his wishes as well, and they're valid too. But the priority here is the health and safety of the baby. So it's not about your parents or his parents or him or you. It's about the baby. And that, I
yeah,
think, bringing it back down to that is what's going to help you get on the same page.
yeah, maybe gonna help me in that one too. This comment you made gonna help me, because it's true. Um, Yeah.
I know it's hard. It's a hard decision to make.
Sometimes is hard because of the environment you are in. You know what I mean? Like,
Families are difficult. It's difficult to say no to family, especially when it's something like this. You know, they want to share the happiness, they want to share the joy with you, they want to meet the baby, but it's very important to set those boundaries and say this is a very important thing for me. And if it upsets you, I apologize. I'm sorry if you're upset by this. I don't mean it personally. I just mean to be taking care of my baby in the best way that I know how. And that's it. Listen, what I always say too is like,
yeah,
if people are mad at you, that's their choice to be mad. It's not you. You're not, you know, if they're
yeah,
mad, it's their choice.
yeah. You're right.
But it's
Well,
hard. It's hard.
it's hard. I know
You
it's
know.
hard. Yeah. Yes. I'm just thinking like my little baby being carried by someone. The first day, the people like, I don't know where this came from. So
I know.
this kind of panicked me a little bit. So
But it's good. It's still early. You have those conversations now and you'll be okay.
no, even my stepkids, I think they like the youngest one, he's 8 years old, but he has a spectrum. He's mild, but he does.
Hmm.
And sometimes he doesn't have control about things.
Yeah, it
And
gets too excited.
and then I keep thinking, I let my baby newborn baby getting my newborn baby in his arms. How this is gonna work in my head? This is not gonna be possible at all. You know what I mean? Like,
I know. And I feel like in the beginning in your mind it becomes something much bigger than it is. In reality, when the time comes, you're going to see they're going to be gentle and kind and
yeah,
loving. It'll be good. Yeah.
yeah.
So, okay, I'm going to wrap it up here. And on the screen, you have my email, my Instagram, phone numbers for myself and for Mama Doula Canada. You already are in contact with Clay, of course. If you have any questions about anything that we discussed tonight, of course, you can go to Clay. That's your first stop is Clay will answer all of your questions. If there's anything that you want to talk to me about, I'm sure that Clay will be happy to put you in touch with me if you have any specific questions about something that we discussed. Otherwise, I hope that was helpful for you, and I hope you got a lot of new information to help you start thinking about how you're going to plan for plan A, plan B, plan F, plan G.
Hmm. Yes, definitely. No, thank you so much. I appreciate your time. I think the content you brought in is really cool because even though some of the topics I already discussed with Clay, but you brought me a little bit different perspective on those.
Oh, great.
So which is good because open up a little more my view of thinking on how to proceed with this and that.
Great.
And
And that's my intention. That's what I wanted to do is
yeah,
just give you another perspective, another way to think about things. And so I know it can be overwhelming. I know there's a lot to consider, but you're at a good point in your pregnancy that you have the time to think about these things. So you're doing all the right things.
yeah. Well, let's cross. I keep telling Sarah, be nice with mommy, be cool.
Let's work together, okay?
Help mommy, help mommy be in the right position. So do your job.
Oh, that's great. Well, anyway, it has been great chatting with you. Thank you so much, Anira. I'm really glad that this got to be a one-on-one. So you got some really focused conversation today. But best of luck with everything. I know you'll do great, and maybe we'll chat soon.
Thank you so much. Have a wonderful night and
You're
a
very
good week
welcome.
ahead too.
Thank you. You too. Thank you.
Thank you. Bye.
Bye.